it has become the third. It has become the third part for the worldwide health management, just right behind the diabetics and the cancer. Normally, the USA and the Europe has already spent uh, billions a year to solve the problem that's causing from the wound care. The reason why the wound care is complicated is because normally a simple wound is simple to solve. However, when the wound is getting infected or have inflammation, the cost is going to rise. And in that case, the cost will increase sharply if an infection occurs. And there are a few questions that we will face when we are having the wound treatment, because for right now, the cure rate of a complex wound is relatively very low. It's only 50% to 60%. So the patients will be wondering where exactly they could get to have their wound to be healed, and they don't know who they could ask for help to cure the complex wounds. So in that case, for the general surgery, for the orthopedic, for the dermatology, all of them actually are not the exactly department that they are going to search for help. They need to go to the wound care center, because the wound care center is going to provide the most professional and helpful advice and cure for those patients who needs the help for the wound care. As you could see, after we build a wound care center, the wound will become only from a complication into a complex disease. In the past, the wound care is only leading by the nurse. After we build the wound care center, it will be leading by the wound care therapy and the specialist. Also, we will have more and variety of the treatments, and that will making the patients feeling more comfortable. And also, when the past, we don't have enough norms and guidelines for the wound care, but in the future, we will have like specification and guidelines to follow. We will be more professional, and the environment that the patients is going to be healed will be changing, not only be limited in the hospital, but it could be in hospital, could be outpatient, could be in the community, could be in their own family, and they could be healed individually. And also, it will shows many benefits for both the patients and the hospital. The cure rate will rise from 60% to 94%. The charge for each dressing will be decreased. According to China's data, the average cost for the dressing is changing from $23 into $6. And for the hospital, the cure rates, as I mentioned before, it will rise. The average length of the stay will decrease into 14 days. So it solved the problem of long-term bed stay, and it controlled the medicine proportion into 60%, which is another benefit point for the hospital. After I told you many benefits for the reason why we need to establish a wound care center, I would like to talking about what exactly it is. And I will show you several cases in China to give you a better reference. As you could see in this picture, this is what, from our point of view, wound care center is going to be. Basically, a wound care center is an independent medical facility for treating wounds that do not heal. It is an organization leading by the wound therapy specialists to help the patient through a variety of treatments and guidelines to heal fast. As you can see in this picture, on the right side, it is the nurse station and the office of the doctors. So this place will connecting all the data from the patients and to giving their better heal afterwards. And after you entering the department, the wound care center, first you could see the ultrasonic Doppler. This device is used to give exams for the patients to measure, to judge about how severe the wound is, to letting the patients know what exactly the wound is actually is, and after that we will have the functional dressings and the debridement system to clean the wound. And before and after we clean the wound, we will able to use the NPWT, which is negative pressure wound therapy, to help the patients to stay healing the wound. And if the patients needs a long-term recovery, they might need to use the light therapy as well. So a wound care center, you could basically see in these two pictures. This is how normally a wound care center looks in the Western world. As you could see, it contains very simple. It's a bed, and it has a nurse and doctors to lead the whole team to have the wound care. So the wound care center will be able to examine and measure your wound. It will be checking the blood flow in the area around wound. It will determine why it is not healing, create a treatment plan. And the treatment will be able to healing the wound, preventing the wound from getting worse and being infected. It will preventing the lead loss, preventing the new ones from occurring or old ones from coming back. It will help the patients to stay mobile and making the patients feel more comfortable than staying in the hospital. Here are several cases that we have in China as a reference. As you can see, this is the First Monetary Medical University located in Xi'an. This wound care center is being consisted for four parts. This is the consulting room. This is the dressing room. The dressing room is where the patients change the dressing, and the consulting room is when the doctors is communicating with the patients and making decisions. The treatment room is where the patients get healed, and the nurse and doctors giving them like surgical debridement or cure. And the waiting room is where the patients waiting for the therapy. So actually this hospital is very large, and it has a team of consisted with doctors and nurse. It has more than 60,000 people a year, and the income is very giant. It has more than 50 millions of USD dollars a year. So it is actually a very successful wound care center. We also can see in this picture, the nurse is operating the carnation to help the patients to healing faster. And on the next picture, the nurse is using is debridement the patient, and as we could see on this picture, the nurse is learning from the doctor about the debridement, about the treatment. So the standardized wound treatment, it needs several devices, and I will introduce them in details afterwards. But basically, these are those pictures is going to show what is exactly inside a wound care center. And also we have another example. This is the Foshan First People's Hospital Wound Care Center. It also has a waiting room, a treatment room, and a dressing room. But here the devices are simpler. You can see in the dressing room, it has our device, the debridement, ultrasonic debridement from our company. This hospital is actually also successful. it has more than 120 people a day, and the income is reached to 4.6 million a year. And also in the Nanning Second People's Hospital, we also have the same arrangement. We have the waiting room, the treatment room, the debridement room. Because in China, normally when we're having a treatment, we need to move the device into the bed side. So all our device is being stored in one room separately. So as you could see in this corner, it has our clinician, it has the air compression device, and it has negative pressure wound therapy. In the debridement, it has the ultrasonic debridement device. So these three examples is going to show you how the One Care Center is working. And after I introduced the reason why and the definition about the One Care Center, I'm going to talking about how we could build a One Care Center. Basically, I'm going to talking about the construction mode for the One Care Center, and after that, we need to keep delivering ongoing education and training for the One Care Center's doctors and nurses. And after that, I'm going to introduce several devices that we could use for the One Care solution. So in China, from our aspects of experience, there are 40% of the members of One Care Centers. They are from the former burn department, because in China it has many burn hospitals before. So normally they are more professional in curing the chronic wounds, because the burn wounds are included for a chronic wounds, and 22% of them are from the outpatient dressing room, because normally the big hospital has a big dressing room, they need to contain more people. So in that case, they change the outpatient dressing room into a One Care Center to containing more patients. And we still have 8% people, and they are the specialists in the diabetic foot treatment. So basically, these are the main parts for the nurse and the doctors for the One Care Center are coming from. And we generally recommend to have a mode that is fixed with doctors and nurse, rather than only establish the One Care leading by the nurse, because as I mentioned before, normally we need a One Care Center that is guided by a doctor, because the doctor needs to know how to link the hospital with the community, knows how to communicate with the other One Care units. While when the group is leading by the nurse, they may mainly know how to operate the one, but they can't arrange the One Care Center better. Taking this hospital in Zhejiang as an example, this hospital actually is coming from a burn department before. After the One Care Center is established, the visits for the patients and the total revenue is increasing years by years. And the One Care Center is growing successfully. It will have students coming to learn in this One Care Center, and it has its self menu, and it established its guidelines for healing. As you could see, there's another case that is the Peking University First Hospital. Also, this hospital obtained the EWMA certification, and this hospital helped to making sure that the average hospital stay dropped from 30 days to 70 days. And the distance for the patients to see a doctor is is shortened in this way. So this is another cases that is in Shanghai NICE People's Hospital. As you could see, it has debridement room, operating room, the ward, and telemedicine, which is a new way for wound healing. So this this hospital, its linkage not only in the hospital and the community, but also its linkage the experts from the worldwide, because as you could see in this picture, there are several foreign experts coming into the treatment for these patients, and also the screen is linked with other foreign experts as well. In that case, the wound care will be more professional because the wound care center is linked with the worldwide, and all the experts from the wound will be able to cure a complicated wound in this way. And also, as I mentioned before, the wound care center is not going to be only an isolated island. It is being associated not only with like our company who provides the devices, but also we could come associated with like the wound care units and the hospital. So we need to establish wound care units in order we could help the patients in the rural area to provide them the device, the treatment, the service, because there are still many people in the world, they are afraid, they're shy, or they have inconvenience to making their want to be healed. So China actually did a lot in this area. We have several hospitals that have the countryside consultation. We have the two-way referral and training. And in that way, as you could see, the community clinical doctors will provide them the door-to-door treatment service. And all the patients are using our device. The first picture, the patient is using the air compression. And the second picture, it is using the phototherapy treatment. It's using the red light function. So in this case, it will be convenient and making the patients more comfortable to heal the wound. And also, we need continuous target education and training for wound care center. We have the World Union Wound Healing Societies. It will hold exhibitions every year to help to communicate the wound healing. And also, when we started, we would have like professional journals. We would have webinars to help to educate people to learn more about the importance of the wound healing. After that, we need peer training. We need skills fairs, we need conference, and after we have the professional certification, we will be able to build a successful wound care center. And as you could see, our company also helped the National Wound Therapy Training course. This is the 2040, the first National Wound Therapy Training course. This course actually is holding every year, every month. So as you could see, there are many nurses and doctors attending this course. And after the course, they will be able to get the certificate, and this is a sign for them who prove them to attend and pass the training, to making them a professional wound therapist. And after that, I'm going to talking about the device that we could use for the wound bed management. As we know that a good wound care center, they requires a lot of device that help to solve the wound bed cure. So it follows the time principle. First, we need to remove the necro tissue. So it will be good if you use our ultrasonic wand debridement. After that, we need to control the infection and reduce the inflammation. In that case, we could use the negative pressure wand therapy. We could use phototherapy system. We could use the ultrasonic wand debridement to making sure that the infection is controlled. After that, we need to keep the wand to be in a moisture statement. We could use the negative pressure wand therapy system and phototherapy system to do that. And at last, we need to remove the non-migration anatomies at the edge of the wand, which could also be done by the negative pressure wand therapy. So I would like to introduce the debridement. As you could see, this is the ultrasonic debridement. We also call it KMaster Wand Clean System. And this is the negative pressure wand therapy, as I mentioned before. It has two types. The smaller one is NP800 and NP100. The big one is NP600 and 800. And we have the dressing and foams. We have the phototherapy system. The blue light is for disinfection, and the red lights help to the wand to healing faster. And I also recommend to use the shockwave therapy system to prevent the diabetic ulcer. It has a good function for this. I will introduce in details afterwards. Firstly, I will introduce the debridement first. The debridement machine, the ultrasonic debridement, will help to create a clean variable wand bed. It will be reduce the bacterial load. It will help to review the granulation tissue. And the most important thing is when we're using this device, the patients will feel less pain compared to the traditional surgical debridement. As you could see in this picture, when we're using our device, normally it is not violent, it's very gentle, and the flow is really bearable for the patients. It will show you more clearly on this black dressing. As you could see, the molecular of the water is being sprayed on the dressing, and it is very effective for many kind of wands. We could use it in all kinds of wands, actually. As you could see, we have several videos for the process for the wand healing with our device. This video shows when we're using our device to cure a diabetic ulcer patient. The original thing that our device could do is we could stretch our device into the deep side of the wand, and in that way it will be healed without using the knife to open the wand. So it is going to be better compared to other debridement equipments. And here are several examples for the use after the debridement. We could see the affected wands. The surface of the wand is being cleaned from a yellow wand surface into the healthy, the red granulation tissue. And our device is very effective. And we also have several assays and the clinical support to prove that the debridement, especially ultrasound debridement, is very effective in disrupting the biofilms and help with the cleaning of the bacteria. After that, I'm going to introduce you the negative pressure wand therapy. It is consisted with one sucking pump, and this is the canister beside of it. It has the dressing kit to cover the wand to remove the extra fluid that's coming from the wand. And we have the big canister up to 1 liter. It is able to help the device to cure the patients with giant surface of the wand. As you can see, this is a perfect example for our device using for the chronic wand, which is the diabetic ulcer. After using our device, you could see the deep effective wound is being healed, and the age and the wound is turning into brand new statements. So we have more cases to showing that our device could use for not only the chronic ones, we could use for the traumatic ones, the compartment syndrome. We could use our device to several different dressings together because our device is powerful enough to connecting and to cover a large surface, a large square of surface, and also it could be able to use for the surgical cure afterwards. So it is very convenient and very powerful. And then I would like to introduce the carnation, which is the phototherapy. As I mentioned before, the blue light is able to have the disinfection function. The red light is going to making the wound healing faster and to control the patient's pain. Normally, the blue light therapy, as several experiments have revealed, after we use the blue light therapy, all the bacteria has been killed after 45 minutes. So this blue light therapy is very effective in disinfection. And also the red light therapy, we have several functions for it. It will be able to making the wound healing better, promote the growth of granulation tissue. It will diminish inflammation, increase the leukocyte phagocytosis, and it will be able to relieve the pain, reduce the 5-HT content. And also our device is going to provide a cold therapy system. When you are using our device, it is not heated. The temperature is only below 39 degrees, so the patients will feel more comfortable, and compared to other devices on the market, this is quite advantageous. And the red light and the blue light will be automatically switching. Here are a case that after we use the carnation, this 95 years old female diabetic patients, after 2 months, after 30 days of the therapy, the tissue granulation has already been prolifed, and she was about to cut this leg, but after the cure, she saved this leg, so it's very effective. We also have another example for the diabetic ulcer. After 26 days of the light therapy, the granulation is prolifed, and is ideal for the skin graft. And after 10 days, the ulcer healed. And this patient has an amputation ulcer. Before the light therapy, as you can see, the wound is revealed, but after 20 days of therapy, the wound is healed. So as I mentioned before, we also have the extracorporeal shock wave therapy, and this device is used for the foot care that is effective in the treatment of diabetic foot ulcers. It is very helpful for the regenerate skin and musculoskeletal and vascular structures. And in the future, our company is also going to provide the ultrasonic Doppler blood flow detector and the functional wound dressing as well. So in a word, the Wound Care Center is going to help the world to healing the wound better, and the wound healing rate will be increasing after we build a wound care center. And thanks for your listening today. And this is all my presentation. Okay.
Okay, thank you very much, Bruno. And now we are going to do the product demonstration in just 1 minute.
Hello everyone, my name is Connie. I'm the product manager from Lifetronic. The next, my colleague Bruno and I will spend 10 minutes to show you the wound products. The first product is ultrasonic wound debridement system. For this product, this model is KeratMask E, which has 3 functions in one machine, including ultrasonic debridement function, high pressure function, negative pressure suction function. Firstly, I will show you the use of ultrasonic debridement function. You can see the machine has a very large touch screen. It's very easy to operate. Now I set the power and the flow rate and start the ultrasonic debridement function. I can also start the function by the foot switch. For this function, we use low frequency ultrasound, so it has a better cavitation effect, which can remove the bacteria and the necrotic tissue on the wounds easily. I also can start the function by the foot switch. The second function is the high pressure function. I will change to the high pressure function here. I can adjust the flow rate here, and then I start the high pressure function. You can see it can remove the important wounds quickly, including the hair and the sand on the wounds.
Okay.
The third function is the negative pressure suction function. We use the ultrasound debride function and the high pressure function. We can use the negative pressure function to collect the waste liquid to the 2 bottles to avoid the second occurrence infection. There is the ultrasonic wound debridement system. The second product is NPWT. For the NPWT, we have 2 types. The first type is the big machine, which are suitable for the hospital use because it have a big pump in our machine, which can collect the waste on the wounds quickly. For this model, NP800, it has a unique function, installation function, which can instill the normal saline or the diabetes medicine to the wounds to reduce the inflammation. Now I show you. We have 6 modes, mode A, B, C without installation function. Mode D, E, F has the installation functions. Now I will show you the installation function. I can set the instill volume and the soaking time and the negative pressure treatment time. Now the installation function is working, we can see the liquid will go into the tube. And now the liquid will go into the wound dressing foam through the tubes. Which can make the wounds moisture. Now the liquid is on the wound. Now is the soaking time. After the soaking time, the negative pressure function will be working. Now the negative pressure is working. The liquid will be going to the canister. For this model, our pressure can be up to 500 millimeter of mercury. So it can be used in the large size of the wounds and very deep wounds. So this is the advantages for NP800, the large pressure and the installation function. We also have another model, NP100. Is a very portable one. The patients can hang it on their body and go everywhere, which will not affect their life. The third product is the phototherapy system. For this device is very popular in China. I can say all of the wound care centers or the wound departments have this device because it's very easy to operate and it can provide many benefits for the patients and hospitals. It includes red light and blue light. Both of these lights can be switched automatically. And we can see now this is the blue light. Firstly, we recommend to use the blue light to kill the bacteria on the wounds. After the blue light treatment, we can use the red light to do the treatment. So it will not cost many manpower in the hospitals, and it can get a very good effect for their economic for the departments. So this device is very suitable for the wound care centers. The last product is the shockwave therapy system. Is an advanced and new technology for diabetic foot ulcers. Our shockwave therapy system uses the pneumatic power. For our product, we can see all of the parameters can be set on the hand piece. So it will not affect operators' operation. During the treatment, the operator can set to adjust the parameters easily during the treatment. So it's very easy for the operators, and there are so many clinical papers to have been proving that shockwave therapy system have a better effect for the diabetic foot ulcers. That is all of my demonstration for electronic wound products.
Hello, everyone. Gauger's time is always short. So now it's the end of today's webinar. As I said at the beginning, today there is no specific ask and answer session at the end. But what you can do, I guess there must be many questions I have already received, by the way, during the whole process of this webinar. Many people leave me questions about many questions. So anyway, there are two ways. One is leave me and leave us, the contact person you have, more questions that you have. The other one is with more questions and specific interest to discuss. For more in the topic of wound care center, we can schedule and set up a specific Zoom meeting just between Levertronic and your group. So that's it. I thank you very much we thank you very much for your time and your participating. Basically, it's just a start, like say hi to all of the teams here to let you know Levertronic is already here, and we can do some really good things together. Okay, have a good time. Talk next time. Thank you.